needs modeling and exposure complex is more important, mainly the cold stress during the late pregnancy, okay, and in digestive diseases too, in the neonatal diarrheas too, are very important the cold stress in the late pregnancy, even in the birth of the day, the daily. Okay, you have different things, and in free runs we could think that the heat stress is not important. Okay, but it's something that is not happening. We have here a farm with near to 1,000 necro sheep of adult sheep, okay? And we see here the temperature humidity index score during the different months. We have 3 months, that June, July, August, and September, 4 months, in which the temperature humidity index had a score over the 70 points. In that month, we have the mortality rate due to the respiratory diseases to a wide respiratory complex is 2/3, 66% of total of death. However, during the time that the score is lower than 70 points, the mortality rate associated to a wide respiratory complex was the 44%. So the risk to die to a wide respiratory complex in pass-through is 2 times bigger when we have a temperature humidity index over the 70 points. Okay? It's very important to understand. But it's very important when we are speaking about housing. Okay? And we need to understand that the climatic and environmental factors are joined. The climatic factors have a huge influence in the environmental factor. We have here the temperature of one farm during 1 year, in a whole year, and the temperature was taken every 10 minutes. Okay? The mean temperature were the same inside and outside the building, but the temperature, the lower temperature, was always lower outside than inside the building, only by the heat that is produced by the animals that are inside the building. Okay? And during the summer, we found the opposite. The maximum temperature is higher than the temperature that there are inside the building. Outside the building, you have more temperature than inside the building. Why? Because we have isolation. Our roofs are isolated. So this way we can find 40 degrees on the roof and only 21 degrees inside the building. Okay? That happened at the beginning of the summer. For example, May. In Spain on May, we can find this situation. Inside the building we have a low temperature or a normal temperature. However, in the roof, the temperature is good. Okay? But that is very, very influenced by the type of building. Okay? We have different types of buildings. This is a typical building, a closed building with a natural ventilation. Okay? This other one is open buildings, and the other one is a closed building with natural ventilation plus the one is a cooling system. Okay? We have these 3 kinds of buildings, and this is the relationship between the maximum temperature inside against the maximum temperature outside the building. We see this relationship. We take out and put the tendons. We see that the tendon lines, the trend lines for closed buildings and open buildings has a linear behavior. However, the behavior of the closed building with cooling have other kind of behavior. That means that when we have this kind of buildings and the temperature in outside is higher than 30, between 30 and 35 degrees, the temperature inside the building is similar or it's bigger than outside. And when the temperature outside is more than 40 degrees, the temperature in the open buildings and the closed building with natural ventilation have the same level than outside. Don't have any effect. However, with the cooling system, we could reduce between 4 or even near to 6 degrees when the temperature outside is higher than 35 or 40 degrees. Okay? The cooling system could reduce a lot the risk of heat stress. Okay? We have this kind of situation. But what happened? When we are speaking about the patterning lamps, we have this thermoneutral zone, and we see that during the May, June, July, and August, they have some period of time that is over the higher critical temperature, so they have heat stress. And what happened with the mortality index? This one is the mortality index when we are seeing the months in which we have heat stress, the mortality index was two times the normal mortality rate. Okay? Very important one. But we have some indicators, and the better indicator to speak about the heat stress is the temperature humidity index. And how to measure this temperature humidity index? You can measure in different ways: the maximum, the mean, the period of time that our animals are without heat stress or with a different levels of heat stress. Okay? All that is very interesting. If we see here the data of one farm during 2008, the mortality rate during the time in which the heat stress was higher, the mortality rate was higher. So it's something that is very repeated in all of our farms. And furthermore, the temperature humidity index is a good predictor to know what happens when you go these animals to the slaughterhouse. You are going to find a lot of pneumonia lesion or not. Okay? When the maximum of temperature humidity index score during the 3 first weeks of the fattening period is lower than 64 points, the proportion of the pneumonia lesion in the slaughterhouse is very low. When this is around between 64 and 84, the proportion is medium. And when the highest score of the temperature humidity index is over 84 points, the proportion of the pneumonia lesions in the slaughterhouse is high. Okay? It's a good way to have a predictor and decide if you need a special treatment for this kind of animals. You need to measure only the first 3 weeks of your fattening period to decide if you need something. Okay? But there are other kind of stressors, for example, the transport. The transport is very important. Okay, when we are thinking about the transport, many different authorities are very worried about that. And for the reason we obtain funds to know what happened in the mortality rate during the fattening period before different kinds of transport. When we are transport the animals less than 5 hours, we have more or less around near to 4% of the mortality rate due to organ respiratory complex. However, when the transport by road is higher or is longer than 5 hours, the mortality rate increased to near to the 6% of total. So we have around a 59%, around a 60% more risk to develop deaths due to viral respiratory complex when our transport by road is over or longer than 6%. Okay? And why? Okay, we measure different data that are in paper, of course. There are data that we measure to know what happened with these animals when they were transported. We measured the cortisol, the serum cortisol, and we found that the levels after the trip was higher than before the trip. And the counts of leukocytes were changed. Before of the trip, our lungs have more lymphocytes and less neutrophils than after the trip. After the trip, our animals have more neutrophils and less lymphocytes. Okay? Change. That means that now we are in a stress situation. Okay? Change. And furthermore, these lymphocytes have less capacity to react against one pathogen. That is the way that we measure the capability of the lymphocytes to respond to these diseases. Okay? The animals that after the trip have less possibility to respond. These lymphocytes are less and they have less capacity. So they have immunosuppression. Okay? Our animals before the transport are in a good state. Later, by transport, they are in a situation that could be an immunosuppression situation. But this immunosuppression is furthermore increased by some concomitant diseases. For example, the TIMA, for example, border disease virus in acute infections. We don't speak about the abortions by border disease. We are speaking similar to a BBD, but in lambs, okay? And coccidiasis. And coccidiasis for us are the most important one, we said before. And the animals that develop clinical signs of coccidiasis, later they are going to develop clinical signs of ovine respiratory complex around 2 weeks later, okay? And the proportion is 2 times more when they suffer clinical signs of coccidiasis to develop later ovine respiratory complex. And when we are speaking about the fattening period, this proportion is 2 times. And when we are speaking about the fattening period in other house, that is something that happened in Spain, that when women, the animals, they are transported to the place, okay, is around 2 times. So, coccidiasis increase around 2 times the risk to suffer later ovine respiratory complex. Okay? Something that is very important for us. And that is related with the time that the duration of the clinical signs of the coccidiasis. For example, when the duration is low, is short, the proportion of the lung contamination are not affected. However, when the clinical signs of this coccidiasis is lower than 2 weeks, is a moderate clinical signs of coccidiasis, the proportion of pneumonia lesions of the lung contamination is 50% higher. And furthermore, the pleural adhesions are higher too. So we have more problems in animals that suffer a bigger or situation of coccidiasis. And the coccidiasis increase the risk, and furthermore, the duration of clinical signs are associated to that. Other thing that is very interesting. This is a situation, typical situation in the field in Spain. We have a first peak of ovine respiratory complex animals affected during the 2 weeks later to arrive the animals to the field. That is related with the immunosuppression due to the transport to the mesothelium, the field, etc. And later we have other peak around 4 weeks later. But this peak is not related to the immunosuppression of the transport of the mesothelium or the wind. What is the cause? Okay. We know that when the animals arrive 2 weeks later, the animals that show clinical signs of coccidiosis 2 weeks later to arrive to the field are increased. They have a peak around 2 weeks later. Okay? Why? By the immunosuppression that's happening with the transport, with the mesothelium. And in that moment, that animals are associated to this second peak, where these animals that suffer this coccidiosis could increase this peak. Okay? And the relationship is again 2 times, near to 2 times. Okay? We have 80% more risk to develop clinical signs when we are speaking about. Okay? But it's something more complicated. Why? Because all these risk factors present a lot of interference or interaction between them, among them. We have a study that I developed for a client that have fields in southwest of Spain, Merino Reef. It's a work with near to 2 million of lambs and more than 27,000 deaths. Was associated the mortality rate with the stock density, okay? And we have this data. When the stock density was very low, 3 lambs per square meter, okay? We suffered a higher proportion of mortality rate, more than 2.2%, okay? In this case, the most important thing that happened is that how the time in the field was longer, the probability to die was okay. It's associated with the time that the animals or the duration of the fattening period. Okay. However, when we have an unstable stock density, we are speaking around 2 lambs per square meter. Okay. We have other influence. We don't have the longer of the fattening period is not important. Here is important the temperature, the climatology, the climatic factors. Yeah? During the summertime, the heat stress period of time, the mortality rate was 1.9, and during the period of time in which we don't have heat stress, the mortality rate was 1.1 or 1.0. So during the summertime, the mortality rate was W at the rest of the year. Okay? Heat stress, W the mortality rate. And in a very low stock density, less than 1 lamb per square meter, okay? We don't have any influence of the heat stress. Why? Because the so good physical comfort reduce the effect of the heat stress. Okay? That is the idea. All of that and interaction. And furthermore, it's more complicated because you know that there are individual factors that depend on the genetics, depend on the weight of the birth, depend on the production of milk of the mother, many things. Even more, depend on the sex of the animal, the kind of the kin of the labor, the age of the dam. But the most interesting thing is that is the measure of stress, the different stress indicators measured at the winning time. When we measure at the winning time the serum cortisol, we obtain all these different responses. Or when we measure the fecal cortisol metabolized at the winning, we obtain all these data. What that means? That each lamb respond different to the same stress. So the individual factor is huge. And we try to define if when we are measure different indicators, for example, serum cortisol, that is easier, okay, is related with the weight and with the stress status of our animals. But the serum cortisol are not related to that. However, the fetal cortisol metabolites are not very well correlated. We divide our animals according to the fetal cortisol metabolites in 3 groups. 50% of the lambs were considered as standard animals. The animals that have a higher proportion of metabolic feces were considered hyperreactive, and the 25% that was with less proportion of fetal cortisol metabolites were considered hyperreactive. What that means that if we evaluate the ovine respiratory complex according to this group, we have taken ovine respiratory complex clinical signs were lower in hyperreactive and standard lambs against the hyperreactive. And furthermore, the ovine respiratory lesions in the slaughterhouse, pneumonia lesion, consolidated pneumonia lesion, was higher in hyperreactive than in hyporeactive. So the stress is something that affects in different ways to different animals. So it's very important. We have different situations with a lot of different risk factors, with interaction between these risk factors, and the individual response is different for each animal. So it's very difficult to control all the risk factors. To sum up this part, we need to speak about the ORC as a very expensive disease. We need to speak about the ORC epidemiology that affects more at the beginning, okay, and is the main cause of death in lambs and in many cases in situ, and climatic environmental factors, the heat stress, the problems of the immunosuppression, the transport of the concomitant diseases, mainly the coccidiosis, and individual factors and their interaction are so big and so huge amount that it's very difficult to control of them, and it's very difficult to define all situations. Okay? With this part, we have finished the first class or the first part of the morning, and now we are moving to other things that is more easy. We are going to speak about clinical science, we are going to speak about lesions, a lot of pictures, and less quantity of information, okay? Less quantity of information, more pictures.
Hello. I don't know if you have any question before we go. Dr. Josemaria.
Complex effect on the reproductive performance of the lamb, affected lambs in later gestation.
I have some hand experience in that. In fact, I have some